So let's talk about the clinical interview. Now, the clinical interview to me is one of the most, if not the most important pieces of getting to know a client and getting to make decisions on what's going on with them and what might help them and all of these things. Had a supervisor who always used to say, he could go in and give people assessment measures, or he could go in and ask people questions and get some information. He could ask for hours and get some information. Or he could go in and be genuine and really listen to someone and let them tell their story, and then at the end ask 3 questions and get a lot of information. Okay? A piece of the clinical interview that's so essential is the clinician. And that is that the clinician is really listening and is genuine and empathetic. There's a word that we use called rapport, and rapport basically means how do the client and the clinician get along? Do we have good, solid rapport? The better the rapport, the better the information that you're going to attain from a client. Okay? So, within the clinical interview, we have unstructured and structured. So unstructured are open-ended questions. So we may say, what brought you in today? What's going on? What made you decide to come in now versus a month ago? We want to find out about symptoms, health status, family background. Tell me about your family. Things like that. Now, structured interviews consist of standardized series of questions. Okay, they are very specifically worded. You have to read them word for word. These are wonderful for research studies. These are wonderful for learning. Learning with structured interviews is so wonderful because you really learn how to use the language. You really have a checklist so you don't forget to ask things. It feels so bad as a trainee when you get to the end of an interview and realize that you forgot some critical piece of information that you didn't ask. So structured interviews are really wonderful for those things. As well as if you're doing formal assessments where maybe a lawyer is going to look at it, a judge, something like that. Again, structured interviews are great. Things that are covered, age and sex, reason for referral, education, work history, current social situations, physical and mental health history, drug and alcohol use, family history, behavioral observations, right? Those things. Okay. Now, let's talk about mental status examination. Okay, so one of the first things that you do when you meet with somebody or you talk with somebody, especially if you're doing a formal assessment, is you assess their mental status. And that is, what do they look like? Or is it, the middle of summer and they're wearing 10 layers of clothing? Is it the middle of winter and they're wearing a swimsuit in your office? Do they, kind of continue to look around while you're talking to them? I had somebody come in for an assessment once who walked in slowly and looked around the room and looked behind the desks and then sat down slowly and said, "What's that noise?" I have a white noise machine. It was totally fine, but he was a little concerned about it being spaceships. So it's important to notice these kind of behavioral observations. So with mental status, we want to find out, do they know what month it is? Do they know what year it is? Do they know current news events that are going on? Those kinds of things. We also want to know, do they have the ability to remember numbers? Do they have the ability to remember what they had for dinner last night? Do they have the ability to do simple math? Do they have the ability to figure out how 2 things are alike? So we'll say, an apple and a banana, how are these things alike, right? And the answer is they're both fruit, FYI. Those things, right? Moving on. So the most commonly used mental status or mental state examination is this one, the mini mental state examination. And This is available online. So if you want to look this up, you can actually, if you want to test your own mental status right now, you can definitely do that. So if you simply Google the MMSE for the mini mental state exam, it will give you a printout of exactly the questions that are asked. And it is super standard. We have people memorize 3 words: apple, table, penny. We ask you now, and then we ask you later. There are 2 versions that have 3 different words. But anyway, excuse me. There is a scoring system with this, and that is the clinician administers this set of tasks and then looks at the scores compared to what does the average person score that is the same age? And is the person then within a normal range of mental status functioning, or are they off? And we need to check in about that, okay? Now we're going to talk about intelligence testing.